25 years ago, our clinical and theoretical understanding of pain took a giant step forward with Melzack and Wall's gate control theory of pain, published in their book, The Puzzle of Pain. For the first time, there was an explanation of why pain varied between patients with the same kind of painful condition, and why pain sensation was influenced by psychological factors like anxiety or confidence. How did they develop this theory? Dr. Melzack.
You have to keep in mind that for centuries we've had the same ideas about pain. And these are summarized by Descartes' little man whose foot is in the flame. And Descartes' view of pain was that when you have an injury, that is like you're pulling the rope in a bell tower. You're pulling the rope at the bottom of the bell tower, the bell goes off at the top and alerts everybody that there's a fire. So what you conclude from that is that you have pain only when there is injury. You also conclude that the amount of pain you feel is proportional to the extent of the injury. So I'll end off by saying that I very often use as an analogy or as a way of thinking about pain, of thinking about the cells that send abnormal messages to the brain as being like the hub of a wheel, with multiple spokes that feed into that hub. So if you can imagine, here is the hub, here are the fibers that send messages up to the brain, and here are these spokes. And you have one spoke, let's say would obviously be fibers from the area that is injured. But there's another spoke that might be input of a very low level from an area that had been injured and where you might have small muscles in chronic contraction or spasm that are sending an input that by themselves don't normally give rise to pain, but with this injury suddenly they begin to hurt. You've got input from the viscera. You've got changes due to sympathetic nervous system activity. You've got a downflow from the brain that consists of your present worries and fears. You've got another downflow from the brain that is produced by your culture and your past experience and everything you have learned about the meaning of the situation. And so, obviously, if you've got all of these multiple contributions to pain, then what we should do is use several together in the attempt to block pain. So you can have the use of a transcutaneous stimulator, for example, to help close the gate. At the same time, you can try to decrease anxiety using psychological procedures. You can use suggestion and the placebo effect, which can be effective in closing the gate. You can use antidepressant drugs, which we know have a pain-relieving effect in addition to decreasing depression. So all of these techniques can be used at the same time to help people who are in pain, and they're being used increasingly effectively.